Hello, and welcome to the Public Health Shift audio edition. I'm Nadia Tekkal. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 22. What clients actually expect when they ask for technical assistance. Today, I want to reflect on a situation that is actually quite common in global health consulting. A client asks for technical assistance. A scope of work is defined, timeline is agreed, and the deliverables are clearly laid out. Everyone knows what needs to be procured. 6 months later, the report is delivered. The analysis is sound, and the recommendations are well grounded. And yet, very little actually changes. Most people who have worked in technical assistance have seen some version of this. The work is credible, the analysis is solid, but somehow it doesn't translate into movement. So the question worth asking is, why is that? If the technical work itself was good, why didn't it move anything forward? In many cases, the answer isn't really about the quality of the expertise. Instead, it comes down to a gap between what was delivered and what the institution actually wanted and needed. We use the term technical assistance all the time in global health. It shows up everywhere, from donor calls to government strategies to institutional work plans. And most of the time, it's framed quite simply, bringing in external expertise to support a specific task. But in practice, what sits behind that request is often more complex. Because while some needs are clearly stated, others are never really articulated. And the distance between what an institution asks for and what it actually needs is often where technical assistance engagements quietly succeed or quietly struggle. One reason for that is the nature of the systems we work in. Public health systems are inherently complex. Policies intersect with political realities. Institutional capacity varies widely, and implementation environments are constantly shifting. So, when a client asks for technical assistance, they are often looking for something that goes beyond purely technical input. Very often, they are looking for help making sense of a situation that feels fragmented or difficult to navigate. That might mean synthesizing information that exists in scattered form, or it might mean identifying where the real bottlenecks lie beneath the surface. In some cases, it might mean helping translate a range of different perspectives into a framework that allows decisions to move forward. In many cases, the most valuable contribution is not new knowledge. It is structure and clarity applied to what already exists. There is also a second dynamic that shows up quite frequently, which is the gap between evidence and action. Many institutions working in public health are already very familiar with the evidence base. So the challenge is not really a lack of information, but more often, the challenge is figuring out what the system can actually do with that information. Technical assistance often sits right at that space. It might involve translating research findings into policy options that are realistic within a particular context, or it might mean adapting international guidance to national realities, or helping an institution move from strategic ambition to something that can actually be implemented. Technical rigor is important, of course, but its value depends on whether it connects to decisions that can realistically be made and acted on. Evidence that cannot travel from analysis to action tends to remain exactly where it started. There is another expectation that almost always exists in technical assistance engagements, even though it rarely appears in the terms of reference. And that is the expectation that the external experts will help structure the process itself. Many institutions operate under intense time pressure and coordination constraints. Bringing together different stakeholders, building enough consensus to move forward, and maintaining momentum through competing priorities can be genuinely difficult. External advisors are often expected to help provide the scaffolding that allows that process to happen. That might mean facilitating discussions, structuring consultations, organizing technical inputs, or simply helping keep a clear trajectory visible when things start to become diffuse. In other words, the role is not just about producing outputs, it's about helping make the process workable in the first place. And interestingly, when this part works well, it is often almost invisible, which may be one reason why it's so rarely acknowledged. Another dynamic that sometimes comes into play has to do with position. Public health decision making often involves multiple actors with different and sometimes competing priorities. Ministries, donors, technical agencies, implementing partners, navigating those dynamics from within an institution is not always easy. External advisors occupy a slightly different position because they are not embedded in the same hierarchies or subject to the same internal pressures. They can sometimes do things that internal teams find more difficult. They can frame issues more clearly, present trade offs more openly, or surface tensions that need to be acknowledged before progress can happen. This doesn't replace institutional leadership, and it certainly doesn't remove the political realities that institutions have to navigate. But it can help create space for conversations that might otherwise be difficult to have. And in some contexts, that space is exactly what allows progress to happen. There is also one function of technical assistance that I think is often underestimated, and that is reassurance. Institutions working in complex and resource constrained environments often have to make high stakes decisions under conditions of real uncertainty. The pressure to get those decisions right and to be seen to have gotten them right can be significant. External technical support can sometimes play a quiet but important role. It can help validate approaches, test assumptions, and add analytical depth. But it can also provide something slightly different: confidence that the direction being taken is defensible. In the best engagements, institutions remain firmly in the lead, but they are leading with more confidence than they had before. And sometimes that confidence is exactly what allows a decision to move forward instead of stalling. When I look back at the technical assistance engagements I have seen make a genuine difference, this function appears surprisingly often. It just tends not to be what anyone writes in the terms of reference. Seen through this lens, technical assistance starts to look a little different because it becomes less about delivering expertise and more about helping institutions navigate complexity and move forward. Technical rigor still matters. Credibility still matters because without them, the rest doesn't carry weight. But again, expertise alone is rarely enough. The engagements that actually lead to change tend to combine analytical depth with something else: an ability to understand the institutional context, to structure processes that allow decisions to happen, and to recognize what an institution really needs, which is not always exactly what it asked for. It's a subtle shift, but it's an important one. Before closing, I will leave you with a few questions to reflect on. When you enter a technical assistance engagement, how much time do you spend understanding what the situation actually needs as opposed to what was written in the scope? Have you ever been brought in for your technical expertise when the real need was someone to make a difficult decision feel safe enough to take? And when you think about the engagements where your work genuinely moved something forward, what actually made the difference? Thank you for listening. If you would like to continue the reflection, you can read the full version of this issue by subscribing to the Public Health Shift newsletter on www.nadiatekkal.com. Until next time, take care and keep questioning how we show up in our work.